The kidneys are pair of excretory organs situated on the posterior abdominal wall. Now, the transpyloric plane passes through the upper part of the hilum of right kidney and through the lower part of the hilum of the left kidney. So, right now you are seeing the hilum of the kidneys. Now, what is the hilum? Hilum is the area in the kidney where some structures either leave or enter the kidney. So, this is the hilum of the kidney. Now, size, shape, weight of the kidney. Each kidney is about 11 cm long, 6 cm broad and 3 cm thick. The left kidney is little longer and narrower than the right kidney. The kidney weighs 150 grams in males and 135 grams in females. The kidneys are reddish brown in color. The long axis of the kidney, it is directed downwards and laterally so that the upper pole is nearer to the medial plane and the lower poles are little away from the median plane. In the fetus, the kidneys are lobulated and made up of around 12 lobules. After birth, the lobules gradually fuse so that in adults the kidney is uniformly smooth. Now, the external features of the kidney. Each kidney is bean shaped. So, you can see the shape of kidney. It is bean shaped. It has upper pole and lower poles, medial and lateral borders. So, you can see there are two poles. There are two borders and anterior and posterior surfaces. Now, each structure in detail. Poles of the kidney. Upper pole is broad and it is in close contact with the corresponding suprarenal gland. So, here you can see there is slight remaining portion of the capsule of the suprarenal gland. You can see. So, here there is a location of suprarenal gland and the lower pole is pointed. So, this is the lower pole which is pointed. Surfaces. Anterior surface is said to be irregular and posterior surface is flat. But often it is difficult to recognize the anterior and posterior aspect of the kidney just by looking at the surfaces. But the proper way to do this is by examining the structures present in the hilum. So, when you examine the structures in the hilum properly, you can determine the anterior and posterior aspect of the kidney. Now, how to see the structures and determine the anterior and posterior structures, that I am going to describe later on. Borders. The lateral border is convex. So, this is the lateral border you are seeing, that is convex, and medial border is concave. In the middle part, the medial border shows a depression and this is known as the hilum of the kidney, where you can see the structures entering and leaving the kidney. Now, the hilum. The following structures are seen in the hilum from anterior to the posterior side. First of all, anterior most structure is the renal vein. So, you can see this thin walled irregular shaped renal vein, which is the anterior most structure. Then there is renal artery. So, right now you are seeing the renal artery which is connected with the abdominal aorta. So, this is the renal artery, thick walled and round in cut section, that is the renal artery. Then posterior most structure is the renal pelvis. So, right now you can see the renal pelvis. Now, what is renal pelvis? It is the expanded upper part of the ureter. So, this is the renal pelvis which is continued downwards as ureter, which is the posterior most structure. So, from anterior to the posterior it is renal vein, then renal artery and then renal pelvis. Okay. Examination of these structures enables anterior and posterior aspect of the kidney to be distinguished from each other. As the pelvis continues inferiorly with the ureter, the superior and inferior poles of the kidney can also be distinguished by examining the hilum. So, you can see the ureter right now. Ureter is always going downwards. So this is the lower pole of the kidney. So by examination of the ureter, you can determine the upper pole and the lower pole of the kidney. So it is possible to determine the side to which a kidney belongs to. So now you can determine which is the upper pole, which is the lower pole, which is the anterior aspect, which is the posterior aspect. So this is the right kidney. So by determination of all these aspects, you can determine whether it is right kidney or the left kidney. Commonly, one of the branches of the renal artery enters the hilum behind the renal pelvis, and tributary of the renal vein may be found in the same plane. So sometimes accessory structures are also seen, the renal artery and the tributary of the renal vein. These are the accessory structures behind the renal pelvis. So sometimes students get confused, but these are the accessory structures. These are the branches of renal artery and tributary of main renal vein behind the renal pelvis. Okay. Now the kidney anteriorly has got various impressions because of the structures related to the kidney. So relations of the right kidney, you can see various areas which cannot be seen as a particular demarcation, but these are the relations of the visceras. So from above downwards, the relations of the right kidney, you can see first of all in the upper pole there is suprarenal area. Below there is hepatic area, that is the impression of the liver. Below that there is colic area, that is the second part, that is the hepatic flexor of the colon. Below there is this jejunal area, that is the jejunal impression, and towards the hilum there is duodenal area. So these are the anterior relations of the right kidney. Now the anterior relations of the left kidney, here there are various areas anteriorly. Near the upper pole there is suprarenal area. So this is the area of the left suprarenal gland. Below there is gastric area. You can correlate these areas in your book as well. Laterally there is splenic area. In the middle there is pancreatic area, and in the lower part of the kidney there are impressions of the small and large intestine, that is the colic area and the jejunal area. So these are the anterior relations of the left kidney. Now the posterior relations of kidneys are nearly similar except the ribs, because the right kidney is slightly lower than the left kidney. So the common relations are as follows. Posteriorly it is related above to the diaphragm, then medial and lateral arcuate ligaments, then from medial to lateral there are muscles, from medial to lateral psoas major, quadratus lumborum and transversus abdominis. There are some vessels and nerves related posteriorly to the kidneys. These are the subcostal vessels and nerves, iliohypogastric and ilioinguinal nerves. In addition, the right kidney is related to the 12th rib and the left kidney is related to 11th and 12th ribs. The capsules or coverings of the kidney, this will be covered in the lecture, but these are the fibrous capsule, perirenal or perinephric fat, then comes renal fascia, and then comes paranephric fat or paranephric body, which is the outermost. So this is from inside to outside. Okay. Now the structure of kidney. Naked eye examination of the coronal section of the kidney. So this is the coronal section of the kidney we have taken. You can see the interior of the kidney now by naked eye examination. And outer reddish brown cortex. So now she is showing you the cortex, and inner pale medulla. You can see the medulla, and the space which is called as renal sinus, where you have seen the hilum, which is the excretory portion of the kidney. The renal medulla is made up of 10 conical masses, which are around 10 to 12 conical masses. You can see the pale conical mass here, which is the medulla. These are called as renal pyramids. Their apex forms the renal papilla. So right now you are seeing the apex, which is called as renal papilla, which will indent the minor calais. So you can see the minor calais right now, where the papilla is related. Now the renal cortex is dividable into two parts. This is the renal cortex, which has two parts. The cortical arches. So outer one is the cortical arch, which forms the caps over the bases of the pyramids, and renal columns, which dip in between the pyramids. So in between the pyramids, there are parts of cortex which is called as renal columns. Each pyramid along with the overlying cortical arch forms the lobe of the kidney. Renal sinus is a space that extends into the kidney to form the hilum of the kidney. It contains the branches of renal artery, tributaries of renal vein, and renal pelvis. Renal pelvis divides into 2 to 3 major calaises. This you can correlate in your book diagram. These in turn divide into 7 to 13 minor calaises. Each minor calais ends in an expansion which is intended by one of the renal papilla. So this is the coronal section and interior structure of the neck eye examination of the kidney. Now the blood supply, lymphatic drainage and the nerve supply of the kidney. The blood supply of the kidney is from the renal artery, which is a branch of the abdominal aorta. So this is a very nice representation of the renal artery, which is a branch of the abdominal aorta. Renal vein directly opens into the inferior vena cava. The lymphatics of the kidney drain into the lateral aortic nodes located at the level of origin of the renal arteries only. Nerve supply, the kidney is supplied by the renal plexus, which is the offshoot of the celiac plexus. It contains sympathetic T10 to L1 fibers, which are chiefly vasomotor. Afferent nerves of the kidney belong to the segments T10 to T12. So here, this is about the external features of the kidney.